directly, and you just heard from one of the resident doctors now on the situation with trying to ensure that doctors are happy, especially in this season. However, there are health concerns that usually comes with not just the season, but also associated with the dry season in general. When I mean the season now, I don't mean the festive season, I mean the weather. When it enters the dry season, there are a few health concerns that come up. We know that that's usually the season for Lassa fever, something that we usually see around December to January and maybe into February or thereabouts. So far, so good. We understand that this year we've seen about 434 cases of Lassa fever and 80 deaths recorded already. Just in December, two people, a medical doctor and a pregnant woman are reported to have lost their lives owing to this illness. But if we were to count from January this year to about now, we have about 434 cases with 80 fatalities. And so there'll be questions as to what are we doing to ensure that every time the season comes, we're able to stem or nip in the bud just before it becomes a full-blown flower tree. It's not the kind of flower anyone wants to bloom. How do we nip this in the bud to ensure that Lassa fever does not spread? We have with us this morning Chioma Danwafo, who is an epidemiologist and incident manager, National Lassa Fever Technical Working Group. She joins us via Zoom this morning. Good morning, Madam Danwafo. Thank you for joining us on Sunrise Daily.
Good morning, Omar. Thank you for having me.
Well, it's disturbing already. Well, even though, yes, we hear that, from the beginning of the year is when we're looking at these figures. But if you're to look at just what has happened now, it looks like we're not yet prepared for the season as well, especially when we think of health concerns that could spring up. How would you rate our level of preparedness, given that we've already lost 2 lives already?
Thank you for that question. So at the NCDC, we have a dedicated technical working group whose responsibility is to coordinate the Lassa fever response in the country. And like you actually mentioned, Lassa fever is a disease that has been with us over 50 years and counting now. And we have the high transmission season that spans from November up until about May. That's the dry season, when we record about over 80% of the cases in the country. So what we do at the NCDC, before every high transmission season, we send out alert letters to the state, reminding them that this is the Lassa fever season, and that they should be able to, intensify surveillance activities, intensify risk communication activities, so that the populace will remember that if you have symptoms of febrile illness, it could be malaria-like symptoms, that it may not be malaria, it could be Lassa fever. So to have that high index of suspicion, not just among Nigerians, but particularly among the healthcare workers, because Lassa fever is a disease that is transmitted via human-to-human contact, which is like the secondary mode of transmission, but the primarily is transmitted from rodents to humans. That's rodents that are infected with the virus when we come in contact with food or drinks that have been contaminated with their urine or feces. So it's very important that healthcare workers have that high index of suspicion and always adhere to infection prevention and control measures so as to prevent any form of healthcare associated infection, which we just had now. On this note, I would like to convey our sincere condolences to the families and to the friends of the patients and the healthcare workers that we just lost to Lassa fever.
Well, it is very sad indeed. You say that you write, you alert the states. Do you get a response from the state? Is there a way to assess the level of preparedness after the letter has been written?
So when we write these letters, we also follow up because the Public Health Department and the Ministry of the Health is responsible, and we have key focal persons that we interact with. We have meetings with the state epidemiologists, reminding them of the need to be prepared. We also pre-position response materials to the state, like the medication for the management of Lassa fever and other personal protective equipment that is needed for the response. So we follow up to ensure all these measures are implemented at the state level. But for healthcare workers to have an index of suspicion, the state has to be on top of it. The Health Management Board needs to sensitize their healthcare workers to be on alert and always to be on the guard.
One of the things that is a bit worrying is the case fatality. So far, so good. We're seeing a case fatality of about 18% already of the number of people, if not more than that, infected. I mean, 80 people dying out of 434 certainly is a source of concern. Is it that medical personnel are a little, I don't know, they don't have such high, I think the question is, what is responsible for the high case fatality?
So for the high case fatality, I'm looking back at what we had in the past. In the past 10 years, we're having case fatality rates of about 30–40%. So that had been continuously declining, and now we're at about 18–19%. Our goal is to have this case fatality rate reduced to 1 digit. That's why we have developed the Lassa fever, the Lassa fever strategic plan that spans across 5 years, which we will be launching soon. But for the high level of mortality, this will be attributed mainly to late presentation to the treatment centers and also a low index of suspicion. Because for Lassa, if you do not initiate treatment within the first 1 week, the prognosis is likely to poor. So that is why we keep advocating for that high index of suspicion. If you treat for malaria within the first 3–4 days and the patient is not responding, please start thinking Lassa fever. And we've also seen comorbidities of Lassa and COVID. Now is the COVID high transmission season too. We are seeing high number of cases of COVID. So it also rule out COVID and then rule out Lassa fever. And there are also chances of comorbidities of the two infections. So we tend to look out for both diseases now. And to add that this is also the CSM season. So we have an integrated approach to response. As much as we are responding to the pandemic, we have technical groups that are also looking out and coordinating simultaneously the response of other infectious diseases, which season is now.
Well, there are a few benefits that have accrued as a result of COVID. At least we know that I think a few more states now have capacity to be able to test. We understand that before now, or before COVID, pre-COVID, it used to be that, you know, only a few centers across the country could test for Lassa fever. But we understand that there are now more centers that could do this testing. How has this improved the detection rate, if at all it has?
Yes, so the Lassa fever laboratory network initially was just 2 laboratories that were testing in the country, and this was currently scaled up to 7 laboratories and counting, because we also had a process of activating more labs. At the beginning of the COVID pandemic, what we did as a country was to leverage on these existing molecular labs that were testing for Lassa fever to be able to diagnose COVID. And as it stands now, we have all the states having COVID tested laboratories. So this is also what we want to do now, to leverage on these COVID labs to be able to activate more labs that can test for Lassa fever and improve the turnaround time of the results, so that once clinicians send the request for samples to be tested, this result will come in within 24 hours. And medication can quickly be initiated, and this will in turn reduce the case fatality rate. So we have leveraged on the gains of Lassa fever to be able to fight the ongoing pandemic. And we're also leveraging likewise on the gains were made for COVID-19 for Lassa fever. IPC, infection prevention and control, is also one aspect of this response that capacity has been built a lot. So we have activated, there have been lots of capacity building across board for healthcare workers, and infection prevention and control has improved. But unfortunately, we still have one or two nosocomial infection, and we keep preaching and advocating to healthcare workers to please protect themselves and protect their patients by adhering to infection prevention and control measures, because it could be Lassa fever, it could be COVID. You never can tell what you're dealing with. It may not always be malaria and typhoid.
Well, I sincerely hope that our health workers are listening to you, and that they do develop this very high index of suspicion, because it's very sad to lose any one of them, and it's sad to lose any Nigerian, but, you know, it's even more, you know, depressing if you're losing people who have been trained to help save lives. I'm wondering now, as we go into the season, Lassa fever, we know, is a very preventable disease. We know that usually, oftentimes, people try to take advantage of the dry season by spreading things, especially food items, outside. That practice is still not changing. I don't know whether the NCDC is having any engagement with state governments to see what alternatives, because if illnesses are preventable, I mean, there's no need for us to be back at this every year. Is there any initiative being, you know, thought of to see how we can, you know, stem the very incident or incidents of Lassa fever in the very first instance?
For prevention generally, the response we have to the Lassa fever outbreak is the One Health approach. So this means that we are working closely with our sister ministries, our Ministry of Agriculture, our Ministry of Environment, in this fight against Lassa fever, because there's a lot for them to do in respect to prevention. For agriculture, they have their LGA and their state focal persons whose responsibility is to ensure that environmental sanitation is maintained. Because when the environment is clean, the rodent interaction with human will be reduced. And for agriculture, for Ministry of Agriculture, issues around food safety and food processing also comes in here. So like the spreading of food on the ground where this is exposed to the rodents to contaminate them, and then when human beings consume it, they can come down with infection. So we are working closely with Ministry of Agric and Ministry of Environment to ensure that Nigerians are sensitized, and that food safety and food processing measures are also top-notch, what it should be. This has been a key challenge. This has really been a major challenge for us. That's why we have the One Health Technical Group at the national level, where the key stakeholders are present and have been working together for this response. And in deployment of the national rapid response teams that also support the state level, we also try to include colleagues from Agric and Environment to work with the state teams to ensure that this happens. Environmental sanitation is implemented, and that food safety measures are also in place.
Well, madam, it's cheering to know that, at least from the NCDC website, CITREP reports on Lassa fever specifically has been ongoing virtually every week. Well, let me say almost every week since 2007. And that is actually quite gratifying. But the latest report has this image that says every state, including FCT in Nigeria, just as you can see, is one way at risk or the other. Of all the ones that are not green, there's been one negative case reported in all those states. One confirmed case in the places where there are, at least one confirmed case in the places where there are green, and the red dots show the severity in some states. Now, if you also look at that diagram, you see that there is high prevalence in Ondo State and in Edo State, and the highlights of the report says 84% of cases are from Edo, 44 in Ondo, 35, beg your pardon? Yes, exactly, 35 in Tarab. And so one is wondering, how is this going to be contained in a way that it doesn't spread further? Now, the reason for the question is this, madam. My colleague asked you the other time because it is the season that these things happen. However, it is also a season where people travel. So in terms of prevention, what are the things that people need to know? One of the things that we've also found out from research is that people may carry this Lassa fever virus and not even know about it, not show any symptoms. So what are the things people should prevent themselves from? What are the things people should protect themselves from as they travel home for the Yuletide?
Our advice to Nigerians is to always keep your environment clean at all times. If you have holes in your house, please block them to prevent these rats from gaining entrance. This is the festive season. There'll be a lot of celebrations, lots of eating, and so the environment is likely to be littered with leftover food. So we should try to keep everywhere clean, prevent the rats from coming in, cover your dustbins, and store your foodstuff in rodent-proof containers. So that is containers that are well covered so that this rat will not have access to them. And please do not dry your foodstuff on the floor. That way you're exposing them to contamination with the feces or the urine of these rodents. And bush burning is also one activity that displaces this rodent from their natural habitat and to the human habitat. So we discourage any form of bush burning this season. And above all, we should always practice good hand hygiene. Always wash your hand with soap and under running water. And if you notice any sign of fever, sore throat, body ache, please visit the nearest health facility. We discourage any form of self-medication. If you go to the hospital and malaria is ruled out, the health facility, the clinician will also start thinking Lassa or COVID. And once any of this is ruled out, then other diagnoses can be made, other differential diagnoses can be made.
It's also interesting, madam, that in that same report, the last report on Lassa fever from the NCDC, it also shows the age demographic of the people that are most affected by this. And it shows that men are affected as well as women within their productive ages. And so is there any specific reason for this?
So for the age distribution of Lassa fever, we know that all age groups are at risk. None of the age group is spared. And for gender, there's really no reason why we're having, for now, for what we know, why we have a higher number of cases among females. There has been some speculations that the fact that females are more are caregivers, so they're more prone to human-to-human transmission. But then we have an ongoing epidemiological study currently in the country and in other 4 West African countries that have the highest burden of Lassa fever in the country, supported by our partner, CEPI. So that will help us to understand really the epidemiology of Lassa fever in the country, because there's still a lot of unknowns around the disease. So this epidemiological study is a 2-year study that will help to understand the key epidemiological indices of this disease. And it will also help us with the oncoming clinical trials for the Lassa fever vaccines.
Well, it is heartwarming to know that a vaccine is being developed in that regard. However, we understand that, for this particular fatalities, which we've just recorded in December, that they're going to be contact tracing. How far is the NCDC directly involved in that? And if they are, how far they've gone?
Yes, NCDC is directly involved in the contact tracing. We have deployed teams to the 2 most affected states. So the state that is affected is Lassa state, where we have unfortunately lost 2 healthcare workers and a pregnant woman. And however, these cases sought for care in the FCT. So there's ongoing contact tracing in Nasarawa State and in the FCT. We have identified all the contacts. They have been categorized, and some have also been placed on post-exposure prophylaxis. Some have successfully exited the 21 days contact without any symptom. So that's currently what we are doing. And if any of them shows any symptom, we quickly collect sample, get it analyzed, and then find out what the result is. But for now, we haven't gotten any secondary case from this particular cluster.
You just confirmed, initially we had been told that 1 doctor died alongside the pregnant woman from whom he was caring. But it seems you're confirming to us now that the 2nd doctor, whom you understand was seeking care in the FCT, has finally passed on. Is that correct?
Yes, that is correct. Unfortunately, we lost the 2nd doctor day before yesterday.
Well, really sad indeed. I'm wondering, do we have... I know that ideally, what we would seek is for no one to lose it, no one to even contract the disease in the first instance. But given the prevalence of this disease, the fact that almost every year now we have cases of Lassa fever, and usually they're in their hundreds, do we have a target? Is the NCDC, beg your pardon, NCDC setting a target for this year to say, look, this is what we've recorded so far. We do not want to go beyond this level. Is there any such target?
So, like I mentioned, we have a strategic plan, and our aim is to reduce the case fatality. And in reducing case fatality, it's very important that we identify cases early. Given that we currently do not have a vaccine for this disease. So the primary focus is to prevent that transmission by sensitizing the public to keep the environment clean and also prevent rodents from coming in contact, and for healthcare workers to adhere to IPC. But like you said, if we cannot prevent, we should also detect early. So once anyone comes down with infection, we should be able to detect it early, initiate treatment, and have a good prognosis so that all the Lassa fever cases can recover from this disease. So our goal is to reduce the case fatality rate while we work at getting a vaccine that is effective. Safe and effective. So we are trying to see how the index of suspicion can be improved. The number of cases that we have this year has significantly declined compared to the previous years, which is a bit worrisome for us, given that there has been no significant intervention. So there has been speculation that this could be as a result of the ongoing pandemic, which has affected probably the reporting of the cases. So what we do is to keep sensitizing our surveillance officers to be on the lookout of those cases, because we do not want to miss a case. Missing a case would translate to ongoing community transmission or even healthcare facility transmission that could lead to deaths among the setting, which we do not want. So if we're able to detect a case early, we can quickly isolate those cases. We have treatment centers and isolation centers across the country where those cases can be quickly isolated and well managed.
So I mean, it's a good thing that, you know, you have a high index of suspicion in terms of why the numbers are lower compared to what has happened last year. Some people might have said, oh, it's because your campaigns have been ineffective. But it's a good thing that you are suspecting that something could be off with that. But I was asking in terms of if you had any, when you say you want fatalities to reduce, if you have any ceiling by which you say it means that, you know, our campaigns have not been effective enough, let us do more in that regard, or what more can we do? Do you have any such numbers by which you say, no, this is totally unacceptable for this year, this is where we're looking to stop at the maximum?
So at the NCDC, we have a set of indicators. We have a set of outbreak indicators that we call the composite indicators. So it encompasses the number of healthcare worker infection that has been detected, the number of suspected cases that has been detected, the number of deaths. So the key indicators that we use to monitor the outbreak. For the 2021 response, we have not been able to reach that the threshold that would lead to the trigger that would trigger the emergency. Aside from now that we are having healthcare worker infection, like we said, these are numbers will be determined by the index of suspicion at the lower levels. Because if we are not testing, we're not looking for those cases and finding them. There's no how we know what is going on in the communities. It's only when we test and then find those cases, isolate them and manage them properly, that we can say, okay, we've been able to detect so numbers and we have been able to prevent so number of deaths. So we have a set of composite indicators that we use to monitor those cases weekly.
Okay, so let me ask whether, you know, how your collaborative efforts is going with the states. I imagine that you have a surveillance system set up with them. How is that working?
So our role is to support the states in the response. And like I earlier said, we have outlined key activities that the states should carry out for this season. The most important among them is to intensify surveillance, to increase the detection. Because if you detect early, you can prevent the deaths. For now, we provide that off-site support and then on-site support for the states that currently have an active outbreak. So that's been working perfectly fine with us. We also have NCDC state teams that are domiciled at the state level. In all the states, we have state surveillance officers that also support the state team in carrying out surveillance activities. We liaise with our treatment centers for the management of those cases. We also liaise with the infection prevention and control focal persons at the state level. We support them with logistics for the response, and the state also does some form of procurement at that lower level. But they are responsible for coordinating at the state level. What we do is to support, and if there's an emergency, we deploy teams to ensure that the coordination, that the response is well coordinated and that the Emergency Operations Center is activated, and it involves both the Ministry of Environment, Ministry of Agric, and all the partners and stakeholders that needs to be on the table.
Okay, I'm going to ask you to stay with us. We'll take a break at this point. When we come back, we will come back to continue the conversation. Please stay with us. Well, we're still talking about the prevention and detection of Lassa fever. It's the season. So far, we understand that there are 434 cases and 80 fatalities. We're speaking with Chioma Dan Wanfo, who is an epidemiologist and incident manager and also of the National Lassa Fever Technical Working Group in the NCDC. I'm just wondering if there have been any benefits so far with COVID. I mean, the emergence of, I don't want to say benefits, but I mean, if there have been any advantages, the fact that we've had to manage a pandemic in the last 1 year, apart from testing centers, which have gone up slightly, have there been any other advantages that this has conferred in terms of being able to manage and detect Lassa fever?
Yes, there has been. So there have been lots of lessons learned from the ongoing pandemic, and we are still learning. Aside from the testing centers, currently all the states in Nigeria have treatment centers. So this means an isolation centers. So this means that if there is any case of Lassa, they can quickly be isolated and managed at the state level. Also, capacity building. The state surveillance officers have built lots of capacity. Their confidence has also improved in the coordination of response. In the past, when we have 1 or 2 cases of Lassa fever in some states, I mean, they'll be running helter-skelter. But now I can confidently say that with the activation of EOCs, with the establishment of EOCs in all the states and with the capacity building, our state teams are now more confident and more equipped to respond to any infectious disease. One of the key gains of this of the pandemic has been in infectious prevention and control. We've been able to train thousands of healthcare workers on IPC. So this has also led to reduction in healthcare-associated infection. Unfortunately, we are having this now, but we cannot overemphasize the need for training and retraining. For the IPC, we also have the online model where healthcare workers can access this training online, because the infection prevention and control measure cuts across board. So we've been able to gain the gains of COVID for not just Lassa, but for other infectious disease. The other aspect is on the electronic reporting using our SOMAS. So we have been able to also deploy to all the states. So now we have real-time reporting. There have been lots of gains from the COVID outbreak and COVID pandemic response and counting. And I can confidently say that the state teams are much more equipped to fight any infectious disease better than they were before the pandemic.
Well, you're sitting on the hot seat now, and I think that seat is going to remain hot for the rest of the dry season as we monitor what happens with Lassa fever. We wish you all the very best. Chioma Danwafo is an epidemiologist and incident manager, National Lassa Fever Technical Working Group at the NCDC. Thank you for coming on Sunrise Daily this morning.
Thank you for having me.
Sunrise Daily continues in a moment with another topic which will be of interest to Lagosians. But who knows what other states will be able to learn from this? Please stay with us.